So, good morning, everyone. We're glad you're here. I want to give you a little background on our summit meeting. This program is provided through an NSP2 grant number 2125, which supports the Maryland Nursing Workforce Center. I want to give you a little background on how we got involved in this NextGen NCLEX. In January of 2020, the Workforce Center sponsored an all-day workshop on NextGen NCLEX presented by Dr. Susie Sportsman. Some of you may have attended that. And we had about 135 attendees in person just shortly before the COVID shut us all down. It was in January. And after that presentation by Dr. Sportsman, we had the opportunity for Dr. Sportsman to consult with the schools of nursing in the state about NCLEX preparation. And 13 of our 25 schools took advantage of this opportunity with Dr. Sportsman. So in the spring of 2021, the Workforce Center pulled together an advisory committee to plan the offering of additional resources to assist the schools of nursing to prepare for the NextGen NCLEX, which is scheduled to begin April 2023. And to put that in context, the students that just entered this fall semester will be the first ones who will be testing with the NextGen. So they are here. The students are here. So the advisory committee and the names of all the advisory committee members are at the end of the agenda with an asterisk by their name, so you can identify all of the wonderful people who've helped pull this together. One of the first things we did was we developed a survey that we sent out to the Maryland deans and directors to determine schools' needs. And based on this survey and consultations with various stakeholders, a series of workshops are being developed to assist with preparation for the NextGen NCLEX. Today's summit meeting is the kickoff for the next year and the resources we will be offering. More information will be offered this afternoon about the upcoming workshops. We have I have a topical agenda for the workshops. We don't have dates and times for everything yet, but we will be. So let's see if I can get this to progress to the next one. The purpose of today's summit is to introduce nursing faculty members to resources available to assist with your transition. And so we worked with the advisory committee, and we're going with a to provide resources to plan, implement, and evaluate your teaching and evaluation of students' ability to make clinical judgments. We want to help you prepare your nursing students to be successful on the NCLEX exam with NextGen questions. And the ultimate goal is to prepare graduates for safe and effective practice. That's what this is all about, is preparing our students to be successful graduates who will provide safe and effective practice. So today, the summit is to provide an overview of the various areas to prepare faculty and students for the transition to the NextGen NCLEX. Our objectives: we hope that at the end of the summit, you'll be able to determine the use of a clinical judgment model in your program, consider the implications from findings from our statewide and national surveys, to evaluate your readiness for infusing clinical judgment into a classroom setting, and to determine some strategies for integrating clinical judgment into the clinical learning environment, and then how to integrate clinical judgment into simulated learning, and to outline some issues that your school may encounter in testing and evaluation related to NextGen. So what we're trying to frame here is that the clinical judgment and the preparation for NextGen isn't just about the testing. It's not just about the testing and the assessment. It's about the whole entire program of study that your students will go through, where clinical judgment is infused both in the classroom, in labs, in simulations,